Haiti. It's a country rich in cultural traditions and proud of its heritage as the first Black independent republic. Yet its people confront the highest levels of poverty and lowest life expectancy in the Western Hemisphere. With the cards stacked against it, Haiti was ill-prepared when the largest earthquake in its history struck on January 12, 2010.
The hardest thing was the bodies. There were bodies stacked up for miles all around the city. Families, babies. That was the hardest thing. I mean, that's something that when you're, in middle school, you see maybe some traumatic images of the Holocaust, and it was similar.
Thousands of health workers poured into the country, along with billions of dollars in emergency aid. As the rubble began to clear, most international aid workers, as well as the USNS Comfort, left the country. Before they could do so, they had to find a place to care for the patients most affected by the earthquake: spinal cord injury victims.
And they've been knocking at the doors of hospitals everywhere in this country, but it requires a lot of resources to care for those people, and they didn't get any response from those hospitals.
When you get a patient who's spinal cord injured, they're going to be with you for a long period of time. There's an awful lot of clinical care that needs to be done. There's an awful lot of rehab that needs to be done as well. And I think everyone was just so overwhelmed that trying to design a program for those with those kind of injuries was very difficult.
When they came to us and they said they've been trying to find hospitals to accept those patients, but they couldn't, we said, wow, but we have no experience dealing with this kind of patient. But if they have no other place to go, our mission is to accept those people. We will manage to find human resources, we will manage to find financial resources, but we will accept those patients. And that's what we did.
The biggest thing was that our Haitian staff said, we can do this. And when our Haitian clinical staff said, we can take this on, we need to take this on, these are people from our country that are suffering and need our help, and if we don't do it, they'll die. That's when we said, we can do this.
Two years after the earthquake, I visited the St. Boniface Hospital in rural Haiti to film the efforts of the Spinal Cord Injury Program. Without the aid of St. Boniface, the spinal cord injury patients would have had a survival rate of less than a year. Mamai is typical of many of them. On January 12th, a wall collapsed on her.
We always say the first responders to the earthquake were the Haitians, were the neighbors, were the people in her family, and they didn't know exactly what had happened. They just knew she was injured. They brought her to the first clinic by their house, and that was totally collapsed. And they continued to just bring her to different places. Eventually they just put her on the side of the road in hopes that somebody would pass by and be able to help her. Eventually she ended up in Santo Domingo on her own. Her family thought she was dead, and they went through that process. They grieved her death, they had a funeral, and they had come to terms with that being the reality.
And she spent almost 6 months or 6 to 7 months in the Dominican with nobody with her, rats eating at her feet, and just, a terrible situation.
Eventually, Mamai was brought back to Port-au-Prince, where the St. Boniface Foundation took over her care. Mamai was paralyzed from the waist down. She was covered with pressure sores. She was emotionally traumatized, and her muscles were atrophying.
But I think that what encouraged her the most was seeing other people surrounding her who had been injured in the earthquake, who had gone through our program, and seeing how independent that they were really motivated her to start going into therapy. And especially when you have someone who's been through it already telling you that, at one point I was in your shoes. I was lying there, couldn't move, I had pressure sores, and it was really the therapy that got me that got me going and got me stronger and got me pushing the wheelchair on my own and got me bathing on my own. And once she saw that, and once she saw that she didn't have to rely on everybody for every little thing, she really saw the benefit of it. And I mean, even to now, she's still pushing and still trying extremely hard.
Mamai has transformed from a scared patient to a role model of the programs.
She's found her sense of purpose again. She's found her sense of worth again. And, you know, I think it's been remarkable to watch her from being a really timid young girl we met in a really terrible situation in a hospital in Port-au-Prince to being somebody who is confident and speaking in radio programs and taking new patients under her wing. She's a really wonderful example of what the true capacity for resilience is, and it's really come from within her. She has really found this ability to be strong and encourage others in the process.
So how does the program achieve these results? It's a combination of physical therapy, psychological therapy, and group support, all administered by a multidisciplinary team under the leadership of a Haitian doctor. The St. Boniface Foundation brought in outside experts who could build the program.
Our goal is to train the Haitians to take care of Haitians, because eventually we will not be here, and they have the means to take care of these patients. They just need to be given a little bit of direction, which is what our role is.
The coolest part for us is to watch a group that 2 years ago couldn't even tell you the definition of a spinal cord injury, and now, I mean, they are the experts.
When you touch this, he's feel that.
Ultimately, the Spinal Cord program attempts to get its patients integrated back into Haitian society. The staff visits patients across the entire country to provide them with the continued care they need.
The mobile clinics are really, you know, an integral part of how we operate, how we keep tabs of people, and how we make sure they feel supported at home. Every month everyone gets a visit, they get their medication, we get a quick checkup on them, we check on their wheelchair, we make sure they're getting out, we assess for their safety just to make sure that everything's going okay.
Yeah. On the last day we were in Haiti, 2 years after the earthquake, we visited Wilgi, one of the first patients in the program.
Wilgi was his class president in school and in high school when the earthquake hit. He was immediately taken into the USNS Comfort, but he eventually ended up with us pretty close soon after the earthquake for long-term care. And I remember Wilgi being pretty depressed, very bright guy. The feeling at the time was that a lot of these patients wouldn't survive a year, that in developing countries, when there's spinal cord injury, with a lack of facilities, the patients just aren't going to survive for a long period of time. I know that Wilgi felt very depressed. There wasn't a great understanding of spinal cord injury, and I know that his family had a hard time coping with his injury as well. And Wilgi, when he went back to his home, there was a lot of work that our team did, especially our Haitian team, social worker, working with the family to get him back integrated into the household and to become a productive member of the household again.
I want to be the best of everything I undertake.
He was able to go back to school. His family pushed him to school to make sure he got there, and I think some community members got involved, and he was back being his class president. And now he has dreams of going on to university. He's really been integrated back into his family, and his family really sees him as a really key part of their future. And so to me, that was a true success story.
Wilgi is just one of many success stories of the St. Boniface Spinal Cord Injury Program. To find out more about their efforts and what you can do to support them, visit HaitiHealth.org.
Game now, réalisé. L'amour